Hello, everyone. Just waiting for some more people to join us. Hello. Good evening, everyone. I'm just waiting for some more people to join us. How's everyone doing this evening? I feel like I should have some music playing. Can you hear me? Is everybody hearing me? Can everyone hear me? Hello, good evening. This is live tonight. Just want to talk about some COVID-19 updates, also known as the coronavirus. Can you hear me? If you have any questions at any time, please feel free to type them in. For those joining, thank you for coming. Just want to take some time out to answer any questions, give a few updates concerning COVID-19. As we know, there's a pandemic going on, and there's a national emergency that especially New York right now is experiencing. We might have others joining us from around the world, but we all are feeling the pressure from this pandemic called COVID-19. So for those of you who did not get a chance to listen to the first live video or do not know exactly what COVID-19 is, just to give you a little recap, COVID-19, also known as the novel coronavirus, is a new coronavirus that has hit the United States. It originated in China. It is not and I repeat, it is not called or known as the Chinese virus. It is called COVID-19 or the novel coronavirus. And this virus predominantly manifests in the sense that you seem to have flu-like symptoms. Because it is a new virus, we are still learning as things continue to develop. So right now, the most common symptoms that seem to manifest with this disease is a dry cough, a dry cough, low-grade temperature, and a runny nose. But recently, as we have heard Idris Elba and Tom Hanks come forth, and they have been corona positive without exhibiting these symptoms. So this is why I wanted to come on tonight and give an update, because people now are saying, hey, what's going on? I'm hearing mixed messages. I don't understand. They said that this disease has different symptoms, but now we're seeing more and more people becoming positive from the coronavirus and do not exhibit the symptoms. So, a little explanation. Again, this is a new virus. Anytime something is new, it must be studied over a period of time. Because this virus is fairly new, showing itself in China, I believe, early December, this virus has only been looked at and studied, examined by the CDC, the World Health Organization, for approximately 3 months. So anyone in the science field or profession knows that viruses, illnesses, the diseases are studied over a period of years. So what we know now is based on the short time that this disease has been studied. And for now, we know that this disease is spreading rapidly. It is not, I repeat, it is not airborne. It is spread through droplets. So one of the questions that I had inboxed to me earlier was, can I explain the difference between droplet precautions and airborne? Okay, and I think that's a great question. So droplets, if you imagine a person coughing or sneezing, that's the best picture I can give you to understand this. When you cough and you sneeze, little particles from your mouth are exhibited. It's excreted, it comes out of your mouth and goes into the air. Those are droplets. They're small droplets that are coming out from your mouth. When those droplets come out of your mouth or your nose, if you're sneezing, they then land on a surface. Whatever is in the area, it will land on. That is droplets. When something is airborne, if you think about when you spray household sprays or Lysol, that happens to be short right now, you can't really find Lysol. It's in the air. And as the wind or as the air moves, it then travels in the air. This disease does not travel in the air. It is droplet. So once you cough and you sneeze, or in some instances you talk, the particles from your mouth will enter and then land on a surface, whether it be a table, a doorknob, someone's face, hands, it will land somewhere. It will not stay in the air. That's the difference between airborne. If it was airborne, it will stay in the air and travel through air. I hope that clarifies the difference between droplet and airborne. So, because this disease is droplet, meaning when you sneeze and you cough or you speak, those droplets come out of your mouth, the CDC and the World Health Organization is suggesting that you stand at least 6 feet away from, well, at first it was anyone who you suspected that was sick, but now they're actually, through social distancing, telling everyone to stand at least 6 feet apart from each other. What that does is when those particles are exhibited from your mouth or your nose, it's enough distance between you and the next person that you do not come into contact with those droplets. I hope that is clear. If it's not, please just send me a message so I can further clarify anything you don't understand. So right now, especially in New York City, we are not in a shelter in place right now. The recommendations right now is that we social distance ourselves from each other. Stand at least 6 feet apart. The recommendation is that you stay inside for as much as possible. It's not a shelter in place. However, it is a voluntary social isolation, meaning that you are not going to be in crowds or around large numbers of people, so that you decrease your chance of coming into contact with droplets that are infected with the coronavirus. So I know New York State is, I believe, 50 people or less can gather. And with that being said, it's still recommended that you don't even risk being around 49 other individuals. So we know now that not everyone who has the coronavirus is exhibiting symptoms. So if everyone that has this virus is not exhibiting symptoms, it's best that you try to stay away from as many people as possible. One of the questions I had was, because everyone has been saying and stressing the fact that if you are immunocompromised or are elderly, that you are at an increased risk. So one of the questions was, I'm young and healthy, why do I still have to social isolate or social distance? Another excellent question. So think about it. If I am young and I am healthy, and I come into contact with the coronavirus and I become coronavirus positive, although I am young and healthy, I now become a carrier. So if I choose to not practice social distancing or social isolation, I then can affect other individuals who might not be so healthy, or who might not be able to fight the disease, or be symptomless like I am. So it's not just for your protection, it's if you become positive or you might be positive, so that you don't continue to spread the disease in the community. Once a disease becomes community spread, which it is now, it is hard to then pinpoint where you contracted the virus. Meaning that I become positive today, it's community spread. I don't know who exactly I got the virus from. So I'm just going to address some questions I got earlier. The next question I got, and it's been hot on social media, is talk about martial law. So martial law, for those who don't know, is when control is given over to the military, and it supersedes our regular law, meaning that if a curfew is implemented, it's then enforced by one of the armed forces. So right now in New York, and I can only speak for New York, there is no martial law in effect. However, what has happened and is happening is the National Guard has been called in over 22 states to help with the control of COVID-19. What does that mean? That means that they are now assisting the CDC, the World Health Organization, local principalities, local hospitals, and administration, distribution of any needed supplies, of helping those get whatever they need to control this pandemic. That's what that means. Right now, we do not have an enforced curfew. It's asked that we as New Yorkers would help to prevent the spread of this disease by social distancing. Those who do not have to work are asked to stay at home. Those who do have to work are asked that you stay away from other individuals as much as possible. And if you do have to be around others, it's asked that you practice good hand hygiene and good respiratory hygiene. Hand hygiene means washing with soap and water when available. If not, washing to disinfecting your hands with sanitizer. Respiratory hygiene means if I have to cough and sneeze, I'm not coughing and sneezing in my hand. I am simply using a tissue to cough and sneeze into. Then I am taking that tissue, disposing of it, and then sanitizing or washing my hands. Other questions, and I do see more people with questions that I've gotten, and I wanted to clarify, is on the treatments. As of right now, there is no cure for COVID-19. Does not mean that it's not treatable. There's no cure, meaning there's nothing that we can give right now that will take away the disease. However, they are and have been using targeted therapy. Targeted therapy means that there's certain medications they can give they know that to help to decrease the symptoms or help to build the your immunity system. So they're focusing on targeted therapy, and they are working on a vaccine that I'm told they have started a trial on the vaccine as we speak. It is nowhere near ready. It's not FDA approved, so we are a long way from that right now. The best way to combat this disease is through social distancing, hand hygiene, and respiratory hygiene. Questions I got was about how do we build our immunity system? What can I do to make my immunity system a little stronger? Well, the first and foremost thing I can think of is diet. It always comes down to what you eat. And we all know or have heard of citrus fruits help with the immune system, help to build it. And that's simply because vitamin C. Citrus has vitamin C. Vitamin C is known to help to boost or build your immune system. Also foods like broccoli, garlic, ginger, spinach, all help to boost the immunity system. Sleeping, a huge one. Your body requires rest. Your body requires rest, and at rest, it rebuilds, it regenerates. When your body it does not have a chance to rest, it does not have a chance to rebuild and regenerate. That's putting you more susceptible or more at risk for developing diseases, such as COVID-19. So it's suggested that you get at least 7 hours of sleep, resting. Another way to build your immune system or to help it is if you smoke. I know it sounds cliche, stop or reduce at least. Smoking is known to cause the your immune system to be slower to respond to diseases such as this. Reduce your stress. Now, with mentioning stress at a time like this, I know everyone is anxious and on edge. Everybody is worried. It's very important that in times like this, that you have an outlet or a way to debrief and de-stress. It is not advised or encouraged that you watch the news 24/7. As we know, COVID-19 is here. It's very relevant, but you can be overloaded with the information if you continue to watch it 24/7. De-stress, meaning read a book, exercise, go for a brief walk outside. Find a way that you can focus on other things other than COVID-19. Another one is exercise regularly. Now, with the gyms being closed, with everyone being told to stay inside as much as possible, there are other ways you can get your exercise in, such as simply dancing, turning on some music, good way to de-stress, debrief, and to get some good exercise, get your heart up, is to maybe if you like to dance. If you, whatever you like to do to get yourself moving, maybe if you want, one of those people that like to clean the house, and you get your heart rate up by cleaning your house, vacuuming. There's other ways that you can get your exercise in and incorporate it in now. And there's great apps also that are available that you can actually watch and do some exercise in your own living room or bedroom, wherever you can. There's a question here. How come they are telling us no large gatherings, but all the groceries have large gatherings every day, all the grocery stores? So you are absolutely correct. And I think because of the mass hysteria, because of the anxiety, because everyone is on edge, everyone is feeling the need to get as much as they can just in case. And that's drawing people to the grocery stores to get whatever they can for a just in case matter. What I can say is online shopping, traveling if you must to the grocery store, trying to go off hours or times when it's not as busy, or trying to just go for a brief amount of time to limit your exposure to others. I understand that we have to shop, we have to eat, there's things we have to get. So we can't stop doing those things. However, we should be very mindful that when we are out and about, that we're making sure we are maintaining good hand hygiene and good respiratory hygiene. I'm going to just see here. I know I received some other questions earlier. Give me 1 minute. So sorry. Are we overreacting, or do we really need to stay indoors? So another great question. No, we are not overreacting. When you look at the numbers, and I have some statistics here, the US cases of COVID-19 have surpassed 11,000 people, and more than 160 people have died. Statistics is telling us that in the tri-state area that we have passed 6,100 people COVID-19 positive, and that 43 of those people have died. So no, we're not overreacting. We have to be proactive instead of reactive. So if that means staying indoors for a period of time versus being sick for a longer period of time, then we need to just do that. And one thing I will say about statistics is, although our numbers are going up, keep in mind we have more testing available now. So the more we test, guess what's going to happen? The more positive people we're going to find. We're testing more, so we expect to see more people coming up positive. That's not anything that's unexpected. We know it's going to happen. Another thing I want to point out about statistics is, I know there's been a lot of focus on the elderly, those over the age of 70, staying in and being cautious. However, of the 12% of the COVID-19 cases in the US that needed hospitalization, 1 in 5 were between the ages of 20 and 44 years old. I want to point that out because the question earlier that came out, I'm young and I'm healthy, why can't I just go and live? Well, this is more of the reason why. although the elderly have in the past been the ones that are the illest or the sickest, no one is immune to this thing. No one knows how it's going to react at any given time. You don't know what your immunity system is like. You can be fighting off a little cold or something, sinus infection, and your immunity system is compromised at that point in time. So the reason why this is important is because we all need to be cautious. Everyone needs to be cautious. Practice your hand hygiene, practice your respiratory hygiene, and social isolate or social distance as much as you can for that reason. No one is immune to this thing. No one. And anything that's new, we don't know how it's going to continue to react. So it's better to be safe than sorry. Another question. What are the best ways to build your immunity system? I think I spoke about that. Does drinking water daily and gargling warm water actually reduce our chances of catching the virus? Okay, so drinking water, as you've known, this is nothing new to anybody, does help you as an individual. Our body is made up of mostly water, so of course drinking water is advisable. However, if the question is, will it help to prevent this disease? No. Drinking water will not help to prevent this disease. It would help you to be healthier and perhaps help your immune system, but it will not prevent this disease. And neither will gargling warm water. Does the heat kill the disease? Now, this is another great question. So when you think about, if you don't know anything about viruses, viruses actually like the cold. Viruses like the cold and then like the dry weather. So when it comes to winter, you would think that in the winter time, you will see more of this virus, or in the past, when we talk about the flu season, which is a virus that we know a lot about, it thrives in the cold. That's just how viruses behave. And it has to do with the moisture in the air and how the viruses travel and it's with how it replicates and all the other things. But yes, viruses like the cold. However, I cannot overstate this enough. This virus is new. We don't know enough about it to say that when it gets warm or in the warm weather, we won't have this issue. This is a new virus. We don't know. So just keep that in mind. And if you think about, if this virus did not thrive or cannot function in the warm weather, we wouldn't see climates with warm weather having COVID positive patients. Another thing or another question was, recently, I believe as early as 2 days ago, some questions about NSAIDs. For those who don't know what an NSAID is, NSAID, it's an anti-inflammatory. Your ibuprofen, your Motrin, very commonly used. It came out, well, the World Health Organization said that they are cautioning people who take ibuprofen when COVID-19 positive, because I think there was a French official said that the drug had some effect on how the people were responding with COVID-19. So I wanted to address this a little bit, because this is just not for COVID-19, but when it comes to having a fever, a high temperature, or temperature over the normal, which is 98.6 degrees Fahrenheit, everyone thinks we need to treat a fever. A fever is your body's natural response. It is when the immune system is starting to kick in place and work. We do not have to treat fevers. What we do recommend is that we treat high fevers, meaning 105 or more. But a low grade temp, which is what we look for or what has been seen to correlate with the COVID-19, does not necessarily need to be treated or try to bring down. It is recommended that for body aches, which you can have, like with the flu, the body aches, is that you use Tylenol. But fever does not necessarily have to be treated. Now, that's different when it comes to children. This is what I'm talking about for adults. Your body's natural response is to produce a fever because your immune system is at work. I hope that is clear for everyone. And then the timeline for this disease, for this virus, seems to be approximately 15 days of incubation, which means between day 1 and day 15 after exposure, you can become COVID-19 positive and or exhibit symptoms of COVID-19, which is why a lot of the recommendations now, with the schools being closing, with the gyms closing and restaurants, it's for at least 2 weeks. And it's to give a chance for that incubation period to kind of take its course. And good news is that China recently just had its first day with no new COVID-19 cases. Now that's promising for us here in the US because China started experiencing this way before we did. So if you think about China's first case being, I believe it was December, the beginning of December, and now we're in March, approximately 3 months for them to get a hold of this thing or get in front of it. Hopefully it won't take us 3 months, but it's important that we follow the directions and do what we need to do to prevent it from continued spreading. And China, when you look at China and how they handled this thing, they completely shut down. They stopped everything. No one was outdoors. People were inside of their houses. They were they quarantined themselves. So it's important that we do our part to prevent the spread of this thing. While I might not be at risk, I'm still held responsible for preventing and getting COVID-19 and prevent spreading of COVID-19. Let me see what other questions came in. How come they're telling us no large gatherings, but I answered that. If choking on your own spit these days is a symptom of corona. No, choking on your own spit seems to suggest some other things going on, but not a symptom of corona. How long after someone coughs does it stay lingering in the air? So I answered that earlier, but I will revisit it. So this disease is not airborne, so it does not stay in the air. However, when you cough, it will land on surfaces within the 6 feet range, which is why they're asking you to stay out of like 6 feet of the next person next to you. So we know that the droplets that come out your mouth when you sneeze, cough, or talk, it spurts about within 6 feet. So, but it is not airborne. It does not stay in the air. This is not an airborne disease. It's a droplet disease. I'm not sure if you have any other questions, but let's go back to disinfecting. So one of the things I've been noticing is people are more vigilant with washing their hands and or sanitizing their hands. However, one of the things I'm seeing is that people are forgetting to sanitize their phones. So everyone walking around now, for the most part, has their phones in their hands or within reach. And we don't realize how often we're on it, we're touching, we're looking at things. And if you touch in an infected area and you sanitize your hands and or wash your hands, but you don't sanitize your phone, you are still introducing the COVID virus that's on your phone, potentially getting into your mouth and your nose or your eyes, which is how we know we contract this disease. So just keep that in mind. We are now very vigilant about sanitizing our hands, but think about your cell phone. The next time you're outdoors, you're on the train, on the bus, or at your place of work, think about your cell phone. And with disinfecting, another thing I wanted to point out is that if you are disinfecting and you're using Lysol wipes, you're using Clorox bleach, keep in mind that when you are cleaning a surface, that surface needs to be wet and air dry. Do not wave it dry, do not fan it dry, let it air dry. And it should actually stay wet for approximately 4 minutes. So it should be wet enough that it takes about 4 minutes for that area to completely dry. So if you're gonna disinfect, you have to make sure you disinfect properly, okay? And I know there's a shortage of bleach now. It's hard to find bleach out there. It's hard to find Lysol wipes at this point, but soap and water if you're indoors. Just the way you're washing your hands, wash it with soap and water. Also, people don't realize that undiluted hydrogen peroxide actually works also. And then alcohol, but it has to be at least 70%, also disinfects. And that goes also for your hands. I know hand sanitizer is hard to find right now, but alcohol can be used. A lot of people have asked me about alcohol in the past, but alcohol can be used. Just be careful, because if you're using alcohol for your hands, it's very drying and or it can actually burn if you have any open areas on your hand. So you have to be very careful when it comes to using alcohol. Hand sanitizer is just not alcohol. It actually has aloe vera and or other essential oils that help protect your skin. So just keep that in mind. I have a question is, have all churches been canceled? So I can't speak to all churches. I do know my church, I won't say canceled, but we went to online. We're going to online services. I don't think canceled is the correct terminology to use, but in compliance with the regulations of 50 people or less, a lot of churches are doing, finding out other measures to kind of conduct their services, which is including live streaming, teleconferences, whatever way you can still get the message out to your people. That's what they're reverting to. Just because, remember, if the recommendation is 50 people or less, and the recommendation is to be at least 6 feet away from the next person, it's really hard to maintain those two when you have a larger congregation, even smaller congregations. Unless you have a huge cathedral, 50 people or less at 6 feet is going to take a lot of space. So yes, a lot of churches are going to other measures to conduct their services. I know I'm giving a lot of information. I'm talking a lot. Please, I won't keep you a lot longer, but if you have any questions, please keep them going. A lot of information is circulating around. If I don't know the answer to something, I will find it out. But I just want to give us an avenue or a way of getting the correct information out there so that we can be safe, and knowledge is power. And when you know better, we can do better as a people. I just want to make sure I covered everything that I've been asked about. We covered hand hygiene, respiratory hygiene, social distancing, mass gatherings, and if we should go with mandatory isolation, quarantine, whatever have you, let me just appeal to everyone who's watching or may see this video. People, we have to do what we need to do to contain this thing. I would much rather be confined for 14 days than to lose my loved ones or perhaps my life. It is not that serious. 14 days might seem long now. Even a month might seem long, but that's nothing compared to losing a life. We have to keep things in perspective. A lot of times we don't like when we're confined, when we're told what to do. We don't like when it comes to curfews. We want to do what we want to do. But there comes a time in our lives when there's some things we must do for the greater good. So just keep that in mind. If it should come to that, I beg everyone, please just follow. It will pass. Summer is coming. Better times will be here, and we will get through this. Okay? And again, I thank everyone for joining today. If you have any questions and you're watching this after the fact, please feel free to reach out. Healthy Me LLC on Facebook, Instagram. You can actually contact me, Denise Henry, at any time. I'll be happy to answer any questions, give you any information you need. This is what I'm here for. Thank you all, and have a good night.